You look at even the VA, the therapists are definitely a bottleneck. I think it was estimated that VA therapists have about, if you like do the numbers, 15 minutes per veteran, which is why it's become such heavily reliant on medication. There's honestly just not enough therapists. If we do every single issue one-on-one, one, the cost is astronomical, but two, there's just a bottleneck. There's not enough within the VA. I've experienced this myself. So the group therapy dynamic just adds a few different layers. One, isolation is a big factor of veterans getting out. They get out of the military and they often move, and then they lose that brotherhood, sisterhood. And going into the corporate world, it's a different dynamic of these people they served with. And so they tend to get really isolated. They tend to feel people don't understand them. And so bringing them back into this group therapy situation, one, brings back that dynamic of feeling belong and supported. And that also brings that comfort for them to become more vulnerable within the ceremony. But then it's also this group support. Not only do they get support, not only do they ask for help, but they can give help. And there's something very therapeutic about helping others as well. You see a lot of your own issues when you're supporting other people. And so it brings that sense of purpose. It brings that isolation, which are often very much lacking in veterans. And then again, from an economic standpoint, if we have the therapist, we have a veteran liaison, we can have groups of 12 to 15 veterans, much more cost effective, probably much more effective in some dynamics in terms of treating them and continuing them on. And then it also adds an avenue that's not just specifically dependent on the therapy session or the psychedelic or whatever substance you're using, because hopefully localized these groups are forming these bonds. And then that's the front line of support. That is the touch point that is going to change this dynamic, where you're not going to call the therapist every day and be like, hey, I'm fine. Hey, I'm fine. But you might call your buddy at least a couple times a week, right? And that buddy is also going to be the first one that sees you if you've fallen off a little bit, or you're not looking too good. They're also the ones that they're going to hold you accountable, but they're also going to be there to support you, to cheerlead you on. So that is such a huge missing piece, because there is some baseline stuff with the VA, but really nothing robust. And maybe it needs to come outside the VA, but the community dynamic is a huge piece. And I think psychedelics coming into the mental health will really herald in that sort of alternative way of therapy. But it is a paradigm shift.